Welcome to a place where private business profit from a captive labour force, yet pennies are spent on medical services to a population in which the Indigenous, the poor and the mentally ill are overrepresented. Where isolation, humiliation and degradation are facts of life. Welcome to prison.
It depends who's telling the story, I suppose. The prisoners would have one view, the people who work in the prison system would have another, and I think it's up to people to decide where the truth is.
Give government propaganda and the media spin doctors the flick. And check out Doin' Time for news, views and tunes on prison issues from Guantanamo Bay to Christmas Island to prisons and detention centres everywhere. Every Monday at 4 p.m. on your community radio 3CR.
We are still fired up and we're still talking about revolution.
Hello and welcome to the Doin' Time show. This is 3CR Community Radio, 855 AM on the dial, streaming live on www.3cr.org.au. And a warning that there may be audio images of Aboriginal and Torres Strait Islander peoples that have died. First, coming up on the show, we're going to be speaking with Auntie Nell Speed, and we've had some really great yarns off air. She's a First Nations woman who has worked in a variety of health settings. She's been a lecturer at uni in schools of health and medicine and 10-year board member on local health district. She's also a consultant and educator of the cultural condominium. And we'll be speaking with Auntie Nell very soon about a very, very important topic. This is stage 4 lockdown in Victoria and also New South Wales. And Auntie will tell you what land she's from. I'll have her introduce herself shortly. But we're going to be speaking with her about health and also about how the gap hasn't been closed between Aboriginal and non-Aboriginal people. And we'll also speak with her really about the growing fears that Aboriginal communities, particularly in regional places, are under-resourced, and how are they coping with the pandemic? What's happening with all the health stuff there? So we'll be speaking with her very soon, a delightful person to speak to. I'm really looking forward to it. And then after that, we'll be speaking with Karen Fletcher, who is a senior lawyer and prison advocate from the Fitzroy Legal Service. And we'll be speaking with her very soon about what's happening in prisons and looking at coronavirus and how do we prevent infection in prisons and what are the figures, because I was actually speaking with Karen off air and we're not even sure what the figures are and what corrections is doing about that. So, yeah, I will be speaking with Auntie Nell shortly. Hello, Auntie Nell. Welcome to the program.
Good morning, and thank you.
It's lovely to have you. First up, Auntie, would you just be able to tell listeners what land you're from and where you are at the moment?
Okay, so I am Biripi Dhungutti, and at the moment I live on Nagowal land.
Thank you so much. So, Nell, we've been talking a lot about health and First Nations people, and also we're in the middle of a pandemic, as you know. Can you just talk to us about some of your work and some of your discoveries, I suppose, and what's happening for you as a woman with lived experience of being First Nations?
Okay, so what's happening in the health thing? I suppose we're talking about the close the gap issues. It isn't really close the gap because the gap's getting wider. So maybe they need to think of a name change. But it's not working. There's a lot of money pumped into various programs, and look, some of them we've had great success with, and others we haven't. But if you're a sector like a health sector, you can only impact on close the gap as far as health issues are. You don't have any say over some of the other social determinants like the housing, the education, the employment, and things like that. So what we really need to be doing is, instead of just channeling money into one sector to do one part of it, we need to encourage those sectors to engage with other sectors so that we can have connecting programs and we can follow on and all contribute to the same thing, which is the better health of Aboriginal people. So an example that I could give you is the health district can employ Aboriginal people, and the higher the employment not only means Aboriginal people are able to engage in society, but it also means that representation in the hospital, our people's going to these services are more culturally, feel culturally safe. So if we had a program that worked on employment and in the health thing, and we worked on, say, smoking in young Aboriginal women who are pregnant, we can only do so much in smoking to help them, but there's a program that has engaged, the health district has engaged with an NGO, which is a social housing group, to work on how smoking, how they can both contribute to helping Aboriginal people in these social housing things address some of the issues that they have to help them with smoking. So that's what I mean. If it keeps just getting channeled into one sector, it doesn't make any difference.
Yes.
It's the same with the Justice Department. The people that are in jail with, say, diabetes, while they're in jail, they're getting a bed, they're getting regular food, they're getting, excuse me, medical treatment. When they come out of jail, then the continuity of care is in a disarray, and it's all about red tape and paper. So I do know of a health district that has worked with Justice to try and resolve this issue, and it's making improvements to Aboriginal people's lives. So while they can channel money into it and say we're helping Aboriginal people, unless that help is constructive and helping to promote the other social determinants, then, you know, like it's just like a black hole.
It really is, isn't it, Auntie Nell? Because really, when you really look at it, Aboriginal people are very much over-incarcerated, and I'm wondering too, historically, Aboriginal women were under a lot of genocide and colonisation, weren't they, in particular when they were having their babies?
Oh, look, I remember my mother talking to me about being in a hospital where she refused to be inside because the Aboriginal women were put on the verandas to have their children. You know, like Aboriginal people, I think, with the health system, a lot of them, it was a place you went to die, really, because it didn't have a very good reputation for looking after Aboriginal people. Might I say, that has improved a lot, and there is, even in the last 10 years, I have seen wonderful examples in health of, you know, Aboriginal culture being embraced and becoming a whole of organisation, issue rather than just not. But look, we had it terrible. Our health before colonisation, there's so many documents that tell about the good health of Aboriginal people. We had a great diet, we had a good environment, and we were healthy. And it wasn't until colonisation that the impacts on our health started to come. So in the first instance, we had things like smallpox and measles and even the common cold and things like that, you know, just desecrated a lot of our people when they first arrived. And we haven't been able to get an equitable platform since colonisation. So,
And a lot of people are scared to go to the hospitals, aren't they?
Look, I think so. I think that's about education and that, though. And I think it's also about the hospitals, the environment they provide, and you know, their engagement with Aboriginal people, so that Aboriginal people don't neglect their health by that fear.
Well, that's right. And I suppose even in prison there would be quite a lot of gaps, significant gaps with health. I don't believe, from some of the people that I've spoken that have left prison, particularly Aboriginal people, sometimes they don't get what they need in prison health-wise in terms of medication or ongoing health assessments.
Look, I wouldn't know about whether they are able to get them or not.
No, that's
but
okay. I just wanted you to know. Yeah.
I do know that the the mental health aspect in prison with our rates, and unfortunately our women are actually more incarcerated than our men these days. So it's not getting better. It's
Correct.
just getting worse.
That's why I wanted to invite you on, because I felt like we needed to really draw attention to that. And also, do you remember, I'm not sure if you remember on the phone call, we had a couple of days ago and I was mentioning the coronavirus, and there are the cases of COVID-19 have gone up, particularly in New South Wales, haven't they? And I wonder about the fact that the highly contagious Delta variant, that's spreading, isn't it, through local First Nations communities? And they're vulnerable, aren't they, and under-resourced? What do you think about that?
Yes, look, not only Aboriginal people are vulnerable out here in our rural areas, we are too. So it is rampaging through places like Dubbo, and I think I heard there were 2/3 of Dubbo in self-isolation. This didn't need to happen. We had a very enviable position where we had no COVID, and now that it's come to the regional areas, the impact of it on our health services, on our communities, on our workforce, and even on what we have available to support the health workers out there, like ventilators and things like that they're just not available. It's just not a case we can do anything about.
Why do you think the ventilators aren't available?
Well, because a health service has to be prepared. You can't just say, put a ventilator in there. You have to have a ventilator that's up to a standard. You have to have the people that are using it trained. You have to have the workforce to be able to monitor it and treat the patient. The thing is, rural areas, there are other issues that impact on the health. There's distance, there's workforce, there's communities that have got overcrowding, there's low employment rates, high health issues, and at the best of times, it is managing. When you have a pandemic on top of that, there's just no plan in place to deal with it.
The federal government really needs to step up.
Look, I'm very disappointed about the amount of supply. I'm very disappointed about people having access to it and able to have good, simple education about it instead of the bits and pieces approach that's coming along. I understand that it's a pandemic and we've never had one quite like this before, but those are just basic community things that you need to do for a community.
Absolutely, and we certainly don't want it to spread. I mean, wouldn't you agree that Aboriginal people are dying younger than non-Indigenous people?
Yes. And the other thing is, this COVID affects elderly people a lot more than children at this stage, is the general census. So in Aboriginal communities, we only have very few elders, and so if it impacts on our communities and wipes out all our elders, that's a huge gap in our cultural heritage that we are missing out on. And in non-Aboriginal communities, the elderly population is a lot larger than their children's one, but the Aboriginal one's actually flipped upside down, and we're different. So, yes, I'm very concerned about our elders.
Absolutely. And you mentioned your mum. So your mum, is she a member of the Stolen Generation?
My mum and my brother were both Stolen Generation.
Right, and you mentioned how your mum was telling you that women had to be on the veranda. You mean on the veranda at the hospital?
Yes.
That is awful.
That is the way it was.
Yeah.
There's a lot of instances where you could go through and see that, how Aboriginal people were treated. But I live in faith and hope, and I work every day to try and provide that opportunity to educate and engage with people so that they get a better understanding of Aboriginal people and their health, and then hopefully work and come up with good solutions, which...
Absolutely, and I'm hoping the vaccine rollout is that a bit slow in the regional communities, or how's that going?
Look, that's been the bane of my existence lately, trying to get access to vaccinations. I myself had to travel 6 hours or 7 hours to get to Newcastle to get mine. My husband and he had to travel 2 hours to a small medical centre up here because our local towns, the doctors weren't registered or able to or set up or to do vaccinations. So, and I've had people who've rung me up, and I've somehow managed to get them into places just to try and allay their fears, because the pandemic's getting closer and closer to these communities, and these people are not. It's not any easier for them to get access. So it might be easy in Sydney, where you can just roll up to a site or a hub, but it's not that easy in rural communities. And you have to remember that we have a lot of small towns, and they've got to travel, like 100 k's is probably just a trip to town, or 50 k's. So they've got to, leave their home and work.
That's right.
And go to it. There's no compensation for them to take the time off. They've got to seek it out themselves, and there's no competent reporting as to where these vaccines are available, and there's no choice for people it's for whether they have Pfizer or AstraZeneca. So that makes it very difficult as well.
It really is quite appalling. Auntie, thank you so much for coming onto the program. I'm going to be interviewing Karen Fletcher soon from Victoria about what's happening in prisons. But I'm so happy that you've been able to come on. Would you like to come back another time sometime soon?
I would love that, Don. That'd be great.
Yeah, I'm hoping I can call you again.
Okay, that's fine.
Thanks so much. Take care.
My pleasure. Safe travels.
You too. Bye.
Female identifying artists aged 18 to 35 are invited to enter the Ellen Jose Art Award, a $15,000 non-acquisitive award. Ellen Jose was a pioneer in Australia's urban Indigenous art movement and a radical activist and social justice campaigner. The award is given in the hope that it will support the winning artist's continued development by providing recognition as well as a financial boost. All 6 finalists will receive an artist fee and have the opportunity for their work to be professionally presented in an exhibition with an accompanying publication. The award is a partnership between the Ellen Jose Memorial Foundation and Bayside City Council. Entries are now open and close on Friday the 27th of August. Head to bayside.vic.gov.au and search for the Ellen Jose Art Award for all the details. A 3CR supporter.
Love comes your way. What can I say? You feel it. You change your way.
The Maritime Union of Australia is pleased to announce the Struggles That Made Us Poster Design Prize. With a $5,000 first prize, the MUA is calling for submissions of a poster or artwork that addresses or is inspired by the struggles, events or historical figures amongst Australian maritime workers. The winning design will be launched on May Day 2022 and featured in a special May Day edition of Overland magazine. So get amongst it, people. Jump online and search for MUA Design Prize to enter. The Maritime Union of Australia is a proud 3CR supporter.
For the struggle carries on. The international unites the world in song.
Say, Wanganjeri. Wanganjeri, it means we are all one. We're all in this together. We're like one big family and we got to look after each other. We got to support each other. And that's what this song's about. We hope you guys enjoy it and we can't wait to rock out for you guys wherever it may be in the future. Thank you. See ya.
I got a message for you.
Hi, my name is Lex Wharton and I listen to 3CR and I hope you do too. I hope that you could support 3CR in its radiothon because 3CR supports the fight for communities and support in all areas of struggles. So please listen to 3CR.
And you're back with the Doing Time show. And you just heard a song by King Stingray, and the song is called Milkamana. And before that, you heard an interview with Auntie Nell Speed, who was talking about the coronavirus and First Nations people and the very under-resourced regional areas. Next up on the show, we're going to be speaking with Karen Fletcher from Fitzroy Community Legal Centre. And Karen is a senior lawyer and has done prison advocacy as well with adult prisoners, and we're going to be speaking with her about the coronavirus and talking to her really about how do we prevent coronavirus infections in prison, what's happening, and what are the figures, because I think they're lost. Hello, Karen. Welcome to the program.
Hi, Marisa. Nice to be here.
It's lovely to have you. Now, I imagine that it must be doubly difficult for people in prison during the pandemic and in particular during the stage 4 lockdown. Can you talk to us about what's going on at the moment in prisons with corona and what you think are some of the problems and issues in regarding the prevention of infection?
Yeah, well, we're 18 months in, and as you say, we're still in stage 4 lockdowns, and I think everybody is feeling it. Just the length of this period of time that we've been subjected to all these restrictions on the outside, 18 months. On the inside, of course, as you said, it is worse. I mean, obviously, already the people in there are subject to a lot of restrictions, and this epidemic has taken away so many of the things that just keep people going inside, and in particular, their personal visits with family and loved ones. That's probably the biggest loss that we hear our clients who are people in prison talk about. And there have been, periods over the last 18 months where there have been able to be some personal visits, but then they get snatched away again every time there's an outbreak, and that's heartbreaking. Some people make it into the car park, for a visit, and then are told it's not happening today because of COVID. And that's that's awful. So the visit's organised, and then when they're in the car park, they get told to go home. That's right, and then that's particularly, the issue, a big issue for visits with kids. There's lots of problems arranging visits with kids, and we've got clients who haven't seen their kids for months and months and months because of COVID, but also because of the usual, bureaucratic requirements around organising kids' visits where kids are in kinship care or state care, and trying to get an apartment to organise visits. All of that stuff is just even more difficult. It's already difficult, but it's even more difficult during COVID. So the emotional toll on people inside trying to talk to family and friends is really heartbreaking.
It would be absolutely dreadful, and I imagine the mental health problems would be skyrocketing.
That's right. Now, we don't have figures on that, but I think that would be important for us to know the kind of mental health issues that people are facing. Some of them we've heard are quite serious, with self-harm increasing inside the prisons, and serious struggles with people's mental health. And I think that's particularly the case when there's sort of promises made that, you'll get a visit, or you'll get, say, a tablet that you can visit family and friends, have a video visit, and then that's taken, for one reason or another, that's taken away. We heard recently at Dame Phyllis that there was a whole bunch of video visits cancelled one day because there was a scare that prison officers had been in a Tier 1 exposure site, a gym near the prison. So they locked everybody down completely for the day and didn't organise any video visits. So people who'd had video visits booked were cancelled. And this is the kind of thing that we're just hearing all the time, people hanging on to the prospect of having some communication with family and friends then being disappointed, and that's really a risk for people's mental health.
I mean, seriously, look, whilst I understand that, we all need to go to the gym and we all need to do things, it really is an added responsibility when you're a prison officer, because that going to a gym is going to affect the whole prison.
Yeah, well, my understanding, it was at a time when people were legally able to go to gyms. But, Marisa, I mean, the overriding thing in this whole issue about COVID in prisons is the same as it's been all over the world since the pandemic started, nearly 2 years ago now, which is that the biggest, most effective public health measure that could be taken to reduce the risk of COVID in prisons is to reduce the number of people in prisons, because there's such high-risk settings, as you say, because prison officers and other people who work in prisons are going in and out all the time, and they get exposed when there's a lot of exposure sites, whatever it is at the moment, 600 exposure sites around Victoria. People who work in prisons are just as at risk from those supermarkets and schools and other exposure sites, and if they take it into the prisons, it's an environment, as we've talked about before, where there is virtually no consideration of ventilation. People are not able to socially distance in units, and it's just, as we've seen internationally, it's a tinderbox. If the infection gets inside, then people, and including a lot of people with serious health issues, especially Aboriginal and Torres Strait Islander people who are so overrepresented in that population, are really at risk. So the most effective thing that can be done is reducing the number of people in prison. And that sort of happened in Victoria. There was a reduction last year. I mean, up to 2019, prison numbers have been escalating and escalating and escalating in Victoria with these bail laws that are sending people unnecessarily to prison. And we have seen during the pandemic a bit of a reduction in prison populations because of consideration of, how exposed people are going to be to COVID-19 if they're put in prison. But that number's going up again now as the courts are starting to deal with some of the matters and more people are getting remanded again.
Karen, also a particular concern are people that are exiting prison, isn't it? And where there even could be homelessness. How on earth is someone supposed to self-isolate if they haven't got a home?
Well, that's a crucial issue. I mean, it's a crucial issue all the time that such a high proportion of people who leave prison don't have accommodation, and that the system for giving people access to secure and permanent accommodation is so lacking, that people are just offered maybe 3 nights in a bad motel or a rooming house, those sorts of things, which is not secure and permanent housing, because there's such a lack of public housing in Victoria. We're the state with the lowest per capita level of public housing in Australia. It's continuing to be a problem. I mean, there's funds around to some agencies to provide some transitional support from prisons, but it's problematic because it's still, sort of corrections funding. People are still subject to sort of a surveillance kind of attitude when they leave prison, when really they should be able to access public housing as a tenant, a long-term secure tenant. If we want people to be able to really keep themselves safe from COVID, then overcrowded rooming houses and crappy motels are not the answer, but they're still what most people are facing. And if they're lucky, other people are on the street or couch surfing.
Karen, I'm conscious that you need to go back on the phone soon for your work, but is it okay if I just ask you a couple more questions?
Yes, go for it, Marisa.
Great. Look, I'm not sure if you know of this particular, what happened last year, but Doing Time Show actually did an interview on a very horrific situation in 2020 when the pandemic first started. And it was in regards to an Aboriginal man by the name of Mr. Kennedy in Victoria, who was deemed homeless, and there were many injustices in regards to his court case and the fact that he was arrested while he was just sitting on a park bench. He had nowhere to go. And in the end, everything was okay and family took him in. What do you think about that?
Well, it's a story that anybody who has anything to do with the Victorian prison system is very familiar with. There is just not an adequate system in place to deal with the homelessness problem. And homelessness is linked to imprisonment, and people are coming out of prison in a worse position than they were when they went in terms of homelessness, because people who do have a lease are losing their lease or their tenancy. It's a crisis situation, and I'm involved in a campaign called Homes Not Prisons, which I would urge people to have a look at, homesnotprisons.com.au, which is calling for a redirection of money, the state budget, away from, $2 billion in a couple of budgets ago were allocated to building more prisons, and they're spending nearly $200 million expanding the Dame Phyllis Frost Centre. Really, that money should be going into the public housing, into a massive construction of public housing, and a housing-first approach to criminalise people getting access to public housing. Because at the moment, people who have criminal histories are getting excluded from a lot of community housing and so-called affordable housing. We need to have a public housing system where there's real support for people. And that's less expensive than building all these prison cells. Let's spend the money on something that's actually going to make the community a safer place, and that's housing, not prisons.
Housing, not prisons, indeed. And finally, in regards to the coronavirus figures and about we don't even know how many people in prison have had coronavirus, do we, if any?
No, we don't have that. And what we're also really concerned about at the moment is that we don't know what the proportion of people in prison who have been vaccinated is. So they've started offering vaccinations to people in the last couple of months, and we are asking for information from corrections. I tried to get it for this interview so I could share it with your listeners, but we haven't been able to get that information yet, like about what proportion of people in prison have been vaccinated, and whether they're offering vaccinations to people that are coming into the system, into the police cells and the prisons, and when they think they're likely to reach that 70 or 80% vaccination coverage in the prisons, that might enable, more personal visits and lifting some of the restrictions that are currently causing so many problems for people in prison. On the outside, we get, a table on the news every night that shows us what proportion of people in Victoria and all the other states have had one jab, what proportion have had two jabs, and how far away we are from reaching, 70 to 80% coverage. We think that information is really important, even more important in the prison setting, because prison is such a high-risk environment for COVID. But that's not public yet. It should be.
Because it's never even mentioned in the media. When they say, 70%, I don't think people in prison even looked at, included.
Yeah, and isn't that the problem with a lot of this stuff? Like, there's so many issues that involve people who've been criminalised and people in prison, but those issues affect everybody in the community in terms of community safety and family and communities. But there's so little coverage of it because, it's just seen as part of the law and order agenda rather than as being part of the community safety agenda and community wellbeing agenda.
And you were speaking before, Karen, about overcrowding and about how, there's so much over-incarceration, particularly of Aboriginal and Torres Strait Islander peoples. Can you imagine the ventilation in those prisons? Wouldn't that be a hotbed for coronavirus?
Yes, well, that is a really important issue in prison.
Yeah.
Like last year, we represented a man at Port Phillip Prison who was at high risk of dying from COVID because he had a heart condition. And what came out in that case was that all the risk management measures that were being taken were all sort of about imposing on the prisoners, no visits, no reduced out-of-cell time, no programs, all of that stuff. But the really important measures that they needed to be taking, like reducing the number of people in there and getting ventilation, were not being addressed. And in fact, at that time, there was like a denial that ventilation was an issue and that, COVID-19 could be spread by aerosol. It's only really recently that the Victorian government has recognised that aerosol transmission is a real problem. Given that aerosol transmission is a real problem, there should be really careful attention being paid to ventilation in prisons as a high-risk environment. As that it is being, they're talking about ventilation in schools, in quarantine hotels, in apartment blocks, and so they should be, but prisons should be really high up on that list for a serious review of the ventilation.
So this man was about to die from coronavirus?
He was at very high risk. If he did contract coronavirus because he had a heart condition, he was in that category, which many people in prison are. So we brought a case in the Supreme Court seeking his release on the basis of the risk of dying, that in order for them to meet their duty of care, that they should actually allow him to be in a form of home detention because he was at such high risk. I guess it was sort of a test case on the duty of care that's owed to people in prisons. He wasn't a risk of he hadn't committed any violent offences. He wasn't a risk of committing violent offences in the community. And he had a really great option in terms of a home detention arrangement. So we brought a case. Now, at the time, the court held that the risk, it was during a period where there wasn't a current outbreak and restrictions were lifted, and the court held that in those circumstances that the duty of care didn't require corrections to allow him to serve home detention. But they did say that if the risk was very high, then that should be a consideration. I guess it was a test case. The court did order Port Phillip Prison to do a risk assessment about the measures that they were taking at the prison to reduce the risk. We weren't very happy with the risk assessment that did get done, and in particular, it didn't address the issue of ventilation. So that's still a huge issue.
That's still pending, is it?
No, the case, it may come back on, but at the moment it's the judgment. You can have a look at the case online. It's the case of Rowson, Rowson, in the Supreme Court, and it was dealt with last year.
I'm so glad that you mentioned that, because that's really a prime example, isn't it, about how prisoners are neglected?
Yes. Yes, and as you were saying, I mean, neglected in so many ways because the issue is just treated as a law and order matter rather than as a matter that should concern the whole community.
Well, we can't really be policing our way out of a pandemic, can we? It needs to be really more about health. There needs to be more of a health response as well.
I think that's a really important point, because that's one of the things that's clear in the community. You know, that police and soldiers the presence of police and soldiers in communities can actually make it less likely that people will get tested and get help, which means the pandemic is worse. And I think the same issue applies in the prison context, in the sense that all of these restrictions on people in prison, rather than an emphasis on the state's responsibility to keep people safe, has a poor effect. As you were saying, because people can come out of prison and be homeless and pose a much higher risk to themselves than they would if there was a sort of housing and health attitude rather than a policing attitude.
And they really should be letting the guy out with the heart condition, really, out of prison.
Well, yeah, look, our position is that anybody who doesn't pose a risk shouldn't be in prison. And the way that risk is measured, we could talk about that for a long time as well. But there are a lot of people, particularly under these bail laws, that require people to prove that they should be given bail, even though half the time they don't even have a lawyer at their bail hearing. But in general terms, people committing offences, people who haven't don't pose a risk to community safety, being in a prison context, should be out as a COVID measure, if nothing else. I mean, it's also a community safety matter, but it's a COVID matter that putting people unnecessarily into prison is a high risk during a pandemic.
Karen, you've been really helpful, and I'm sure that listeners, particularly the ones that are listening from prison, will be very pleased to hear this interview, because I really don't think that there's enough coverage in the media about this. They're too busy reporting on, the violence exhibited by the anti-lockdown thugs, or I'm not going to call them protesters, and talking about, I mean, it's good what they're doing in some ways in terms of the coronavirus, but there really needs to be more in the media in terms of impoverished communities. And prison is a community, whatever people might say.
Yeah, and it has a huge crossover with, as you say, disadvantaged and impoverished communities. There's a big crossover. And I think, what's happening to people's mental health and their physical health after nearly 2 years of this is really magnified in prisons, and that means it's going to be really magnified as people, move in and out of prisons in these communities. And that's a risk in itself. Beyond the COVID risk, the risk to people's mental health is huge and something that needs to be addressed. We can't just continually, as you say, try to police ourselves or surveil ourselves out of this epidemic. There has to be a more humane and human rights focused approach to dealing with the pandemic.
Karen, thank you so much for coming onto the program. It's been great having you.
Thanks, Marisa. It's always great to talk to you.
Good on you. Thanks a lot. Take care.
See
Keep
ya.
up the good work.
You too. Bye.
Bye-bye.
I really am not understanding why people aren't seeing the fact that prisons are an integral part of a public health response to a pandemic. Like you, I'm really concerned about whether the data is being released very honestly about illnesses within prison. I have suspicions it's not, but really we need very strong leadership in this country that actually cares about people inside our most vulnerable populations inside. That's what we need, and that's not what we're getting right now.
We need to keep radical voices on air. Subscribe now.
Go to 3cr.org.au/subscribe or call the station on 9419 8377.
A message from Victoria's community sector.
I'm looking forward to not worrying that my patients are going to die of COVID.
To no one else being separated from their mum in aged care.
I'm looking forward to our wedding and having our family and friends from overseas here with us.
I really want to see my mum.
I'm looking forward to being able to welcome guests without a mask on.
To having all the sports back to normal so that my family members can come and watch me play.
I look forward to performing in front of a big crowd again.
So please, get vaccinated.
Please get vaccinated.
Please get vaccinated.
Let's get back to the good things.
I ask you to get vaccinated.
For all of us.
Please get vaccinated.
A message from Victoria's community sector.
A 3CR supporter.
Fitzroy Legal Service has launched a free information and advice phone service for people who have been stopped, questioned, fined or charged for breaching COVID-19 restrictions. Have you been fined or charged under the new laws? Or stopped and questioned by police for being outside?
Call 0434 136 501. Weekdays between 9am and 5pm. That's 0434 136 501. Or head to fitzroy-legal.org.au for more information. You can also report incidents at covidpolicing.org.au.
Fitzroy Legal Service is a 3CR supporter.
And you're back with the Doing Time show. And you just heard an interview with Karen Fletcher from Fitzroy Community Legal Centre, and she was giving some very, very interesting insights about coronavirus and prisons, and looking at the fact that it's important to have a health response rather than a police response. We're nearing the end of our show, but I just wanted to read out a little article. It's a bit old, but I think it is relevant in terms of Aboriginal deaths in custody, and it's written by Sydney criminal lawyers. And it's a very interesting article about Tanya Day. Failure to press criminal charges over Tanya Day's custody death reflects wider injustice for First Nations. And this was by Paul Gregordi from Sydney Criminal Lawyers. And I won't be able to read all of it, but it'll just be a bit of an edited version. But it's just good to just get a little bit of insight. And remember Tanya Day, her anniversary is, after all, coming up in December, the anniversary of her death. So I'll start. Tanya Day. The decision to charge two Victoria police officers that the state coroner suggested could potentially be found criminally negligent in relation to the ultimately fatal treatment that Tanya Day received whilst being held in police custody has left a bitter taste in the mouth of many. The decision not to charge, None more so than the family of the 55-year-old Yotadota woman left behind. Victoria Police told The Age that after an assessment of the evidence and receiving advice from the Victorian Director of Public Prosecutions, it would not be pressing charges against the two officers involved. It's extremely raw that Danny Walters and Edwina Whale received no punishment at all for taking our mother away from us, Auntie Tanya's daughter, April Day, tweeted following the announcement. She added that Victoria Police and the DPP make a mockery of the justice system. In a joint statement, Ms Day's 4 children have suggested that the DPP had decided to let the officers off in relation to having left their mother to die on the floor of a police cell based on a flawed investigation that lacked independence. The Day family criticised the authorities for coming to the decision with no consultation with them or the broader Aboriginal community, and they indicated further that the one chance over the last 30 years to bring about justice in an Aboriginal death in custody case has been missed. A prejudicial system. Tanya Day died in hospital on the 22nd of December 2017 from a brain hemorrhage caused by several falls she sustained within the first hour of being placed in a cell at Castlemaine Police Station. After suffering these injuries, she was then left lying on the floor of the cell for 3 more hours. Prior to being taken to the lockup on 5th December, a conductor had woken Auntie Tanya on a train bound for Melbourne asking for her ticket. Having been drinking that day, the disoriented woman couldn't find it, so the conductor decided to call the police. This led her to her being placed in a cell under the watch of Sergeant Edwina Nell and leading Senior Constable Danny Walters. And after 4 hours of neglecting to follow cell monitoring protocols correctly, the officers realised Miss Day was in need of urgent medical treatment. I'll just stop reading that because we are nearing the end of our show. But just wanted to begin, I suppose, just doing a little bit more coverage on Tanya Day, given that her death in custody it did occur on the 17th of December. That was the anniversary of her death. Sorry, the 21st of December. So, and beginning some coverage for that. Anyway, it's still stage 4 restrictions. There's been no announcement since at all in regards to lifting lockdown. So keep up the good work, everybody. Goodbye from Marisa. Take care of each other, and we'll be going out soon with our theme song, Black Fella, White Fella by the Rumpy Band. And stay tuned every Monday from 4 till 5 for the Doin' Time show. Thank you. Bye.
What you
as long as you are true fella, as long as you are real fella. All the people of different races with different lives in different places. It doesn't matter what your name is. We got to have lots of changes. We need more brothers if we're to make it. We need more sisters if we're to save it. Are you the one who's gonna stand up and be counted? Are you the one who's gonna be there when we shout it? Are you the one who's always ready with a helping hand? Are you the one who understands this family plan? Black fella, white fella, yellow fella, any fella, it doesn't matter what you color, as long as you are true fella. All the people of different races with different lives in different places. It doesn't matter which religions, it's all the same where the ship is sinking. We need more brothers if we're to make it. We need more sisters if we're to save it. Are you the one who's gonna stand up and be counted? Are you the one who's gonna be there when we shout it? Are you the one who's always ready with a helping hand? Are you the one who understands this family plan? Stand up and be counted. Stand up and be counted. Are you the one who's always ready with a helping hand? Are you the one who understands this family plan? Are you the one who's always ready with a helping hand?
You've been listening to a 3CR podcast produced in the studios of independent community radio station 3CR in Melbourne, Australia. For more information, go to allthews.3cr.org.au.